Hey everybody, this clinical pearl and video will be about neck pain, and I'm just going to adjust my camera here. Sorry. Uh, we all suffer from neck pain, and it's extremely common. I suffer from it. I get headaches. Uh, People sometimes come in after flying on an airplane and they can't move their necks because they were sleeping in a certain position or they haven't moved for 8 hours. It's fairly common. I see that a lot in my clinical practice. I'm talking about the neck pain that is persistent. I believe that when you have persistent recurrent neck pain, there's generally another source other than your neck that is driving your problem. For acute neck pain, I actually put collars on people sometimes because they can't turn their heads. It's so painful. They're getting radiating pain down their arm. That does help. Also, icing is great for acute neck pain, but I'm talking about the chronic pain, the persistent neck pain that's not going away. And I always like to give case examples because I believe they are a level of clinical evidence and clinical expertise. So I have a patient who literally couldn't, for I would say 8 months, couldn't really turn her head to the left. I know it's showing the opposite on the video, but she couldn't turn her head to the left. And she had seen me, actually flew in to see me from another state. She had some business here in New York, and I was treating a friend of hers. And she had work done on her neck, and she had a quote-unquote herniated disc in her neck, treatment geared all towards the herniation, but she wasn't really getting any better. She was getting short-term relief only. So in her history, her medical history, and there's one clinical pearl that you learn today, whether you're a physical therapist listening to this or a lay person listening, past medical history, past movement history, past injuries matter. And in this particular case, she had a right clavicle fracture a year prior. So when you turn your head to the left, you need mobility in your collarbones, your clavicles. It's a small amount. Trust me, it's not a lot of mobility there. But all of the mobility and the treatment geared towards her neck wasn't giving her the long-term relief that she wanted. So based on my assessment, and I look at the whole body, it's the whole body, whole person approach, I worked on releasing and giving her a little bit more mobility to her clavicle, her collarbone. She was right-handed, it was her right collarbone, and that actually she regained full rotation with that. So I didn't need to do a lot of exercise per se for that. I did some movement control, but she just needed some basic release. So once again, if you're not getting the relief that you want, there could be another source to your problem. Hope you enjoy it. Bye.